Thrombolytics. So the name itself, it's saying thrombo means clot, lytics means breakdown. Means these are the drugs which are used to lyse the or break down the clots. Let me discuss. Contents, definition, classification, mechanism of action, adverse effects, contraindications, and uses. Let me start with the definition. So this thrombolytics also called as a fibrinolytics, because you know well that clot final step formation is a fibrin formation, means thread-like structure we called as a fibrin. So these are the agents which break that fibrin. So that's why it is called as a fibrinolytics. So these thrombolytics or fibrinolytics will lyse the clot or thrombi by activating the natural fibrinolytic system. That means in our body, a natural fibrinolytic system is available. Means when clots are formed, automatically our body itself will break down the clots, but it will take time. So we need in few conditions the rapid breakdown of the clots to avoid the further severity of the diseases. So in that case, we'll give the artificial thrombolytics or fibrinolytics. So these thrombolytics or fibrinolytics will reduce the, it breaks the clot by activating the natural fibrinolytic system. Classification. So these thrombolytics are mainly classified into two types: first generation agents and second generation agents. First generation agents, example streptokinase, urokinase. Means these are two drugs, streptokinase and urokinase, are very first drugs used for the treatment of clots related diseases. Later, the second generation agents are innovated, because streptokinase or urokinase will act without targeting the receptors, but second generation agents are little modified and it will act by targeting the receptors. Example: altiplase, dutyplase, tenecteplase, retiplase, and antistreplase. Let me discuss about the mechanism of action of thrombolytics, either urokinase or streptokinase, how it will act. So usually thrombolytics will activate the plasminogen. So this plasminogen is naturally occurring protein present in a plasma, and usually it binds the fibrin. So the tissue plasminogen activator, in a short form we call it as a TPA. So this tissue plasminogen activator is an enzyme. Usually it converts the plasminogen into plasmin. So after conversion of plasminogen into plasmin, this plasmin will degrades or breaks the fibrin, so that there is a dissolve of the clot. So like this, thrombolytics will break down the clots. So thrombolytics will activate the plasminogen. It is naturally occurring in the body and it is present in the plasma, and which is binds to the fibrin. So the tissue plasminogen activators converts the plasminogen into plasmin. So that plasmin will degrades the fibrin. Degrades means it will make like very minute pieces of fibrin. So there is a dissolve of the clot. This is the mechanism of action. Adverse effects: it causes bleeding in case of the persons who have bleeding disorder. In case of bleeding disorders, if we given this thrombolytics, it may increases the bleeding, and it causes hypotension, because it causes the arterial dilation, so that it cause there is a fall in blood pressure, and it causes fever and allergic reactions. Why it will cause fever means, when there is a rapid breakdown of the clot will happen when we given thrombolytics. That time our immune system will feel like something happening differently, so that it will start fighting, so for that we'll get a fever. And it also causes allergic reaction, because the streptokinase and urokinase, these two drugs usually foreign substances, so that our immune system will react with that. So there is a release of histamine, so that it causes the allergic reaction. Contraindications. So when we should avoid the thrombolytics, we should avoid in case of recent surgery, because during the recent surgery there is a stitches will have, they will put the stitches to just reduce the bleeding and all. So here if you given thrombolytics, what is the clot form that will be breakdown and it may cause a bleeding. So to avoid that bleeding, we should avoid in case of recent surgery. Also in case of injuries, when injury will happen, there is a lot blood bleeding will be there. So to avoid that bleeding, usually we'll give the coagulants. If you give an anticoagulant means thrombolytics, it will act opposite to that, so it will lyse the clot so that there is a increase in the bleeding, so that we should avoid in case of injury. And also we should avoid in case of gastrointestinal bleeding. So during peptic ulcer and all, there is a gastrointestinal bleeding will be there. So if we given thrombolytics, still more it will increases the bleeding, so we should avoid. And also we should avoid in case of severe hypotension, because already it have a side effect of hypotension. If the person have severe hypotension, if we given thrombolytics, again it causes fall in blood pressure, so it will cause very serious effect, so that we should avoid in case of severe hypotension. And also in case of bleeding disorders like a hemophilia, if you given thrombolytics, again it may increases the bleeding, so we should avoid in case of recent surgery, injury, gastrointestinal bleeding and bleeding disorder, just to avoid the excessive bleeding. And in case of severe hypotension, we should not go with the thrombolytics because it has a side effect of hypotension. Uses: it is used in myocardial infarction, deep vein thrombosis, peripheral arterial occlusion, pulmonary embolism, and stroke. Thank you.